Welcome to UAB Medcast, a continuing education podcast for medical professionals, providing knowledge that is moving medicine forward. Here's Melanie Cole.
Welcome to UAB Medcast. I'm Melanie Cole, and today we're talking about the never-ending drippy nose, practical solutions for chronic rhinitis. Joining me is Dr. Do-Yeon Cho. He's an otolaryngologist, a specialist in rhinology and sinus surgery at UAB Medicine. Dr. Cho, thank you so much for being with us today. So many people struggle with a constantly dripping nose. I hear that all the time. So what exactly is chronic rhinitis? How is it different when we hear people say, oh, I've got seasonal allergies or a cold? Tell us a little bit about how those three things are different.
Yes, chronic rhinitis, it simply really means it's like inflammation inside of like nasal cavity, your lining in your nose. So it's symptoms like, for example, like you do have runny nose, also congestion, stuffy nose, and also sneezing. And also a lot of people complain about post-nasal drip, which is lasting more than 12 weeks, about 3 months, that we call chronic. So chronic rhinitis are those symptoms. Of course, exactly, Melanie. You just really hit the right marks about people talk about can be a flus or something cold or allergies. So cold usually about very short-lived, which means caused mostly about the viruses, and also like more of a like clear, but at the same time sometimes very mucousy and the yellow strainage. And it's usually less than about 4 weeks, less than 6 weeks. And seasonal allergies, they probably tend to fluctuate with pollen exposure. So right now, we're in spring, so probably there are a lot of tree pollens. And those symptoms are also combined with some sneezings. And also, it actually gets better when the season is over. Those are the seasonal allergies. But chronic rhinitis, it's an ongoing issue. It also can be related to allergic or can be also non-allergic. But usually, it doesn't really fully resolve its own.
Okay, well, thank you so much for explaining that. What are the most common reasons that you see every day that someone's nose keeps running all the time?
Well, there's two categories, allergic rhinitis and non-allergic rhinitis. I told you earlier, allergic could be triggered by some allergens, for example, like pollens, if you're dust mite, or you have cat or dog denders or some mold. But if you're non-allergic, which actually triggers like weather changes or any temperature changes or probably strong smells or even eating. I do have a lot of patients coming to the clinic with a chronic drainage from the both sides of nostrils when they're eating food. That's really affecting their quality of life.
So then, are there triggers? Are there things that make chronic rhinitis worse, Dr. Cho, when we think about, things in the home and filters and just dust mites? I mean, there's all kinds of things that make people with allergies get those triggers. But for rhinitis, are those kind of similar?
Yes, very similar, but the chronic rhinitis symptoms, it was been told that a lot of studies demonstrate it's got worsening when you get older. I also getting older, I noticed that there are more clear drainage coming out my nose where the environment changes for eating food or any temperature changes. So a lot of times the allergies are exactly related to the dust and pollens, environment allergies, but also like temperature changes, cold airs or strong odors or perfumes, even smoke or some like spicy food or even alcohol smells or air pollutions. All these ones can trigger sometimes of the non-allergic triggers. And then a lot of people think that these kind of non-allergic triggers, sometimes they're really unrecognized and they probably didn't know what are actually causing this, but they probably can notify themselves carrying tissues with them all the time. So that was one of the things you probably can notice it.
Yeah, that makes so much sense. So when we think of first line treatments, do nasal sprays, antihistamines, do those work for people that have this chronic rhinitis, that have this all year round, and it really can affect quality of life and the things that you do? Are there some treatments for first line? Tell us what's going on.
So if you do have chronic rhinitis symptoms, there's a lot available in your over-the-counter medication. If you don't need any prescriptions, you can start with the oral antihistamines. Also, you can just start nasal steroid sprays. These are usually the first line of effective treatments, especially when you're allergic rhinitis. Even though you're not allergic, all these steroid nasal spray working as an anti-inflammatory, they reduce some inflammations, and they also, some patients really respond pretty well. And these are the one of the first things that I recommend. Another option is you can also rinse your nose with the saline. That also gonna like mechanically wash out some of the allergens and pollens or dust from your nose. That also can help you to relieve some of your symptoms as the first line.
Now, tell us about a procedure that you offer at UAB for intractable chronic drippy nose. Is it temperature-controlled ablation of the posterior nasal nerve? That's what you're doing there?
Yes, this is an exciting procedure. Before we actually recommend this procedure, when the patients come to our clinic, we also give another spray called anticholinergic nasal spray, which is one of the spray that really work for the chronic rhinitis, especially for those patients who have a lot of drippy nose from the strong smells or eating foods. So a lot of these symptoms triggered by, there's a nerve called the parasympathetic nerve, and this anticholinergic nasal spray, sorry about this long name, but this spray really helps these kind of drainage. So when these people are respond to this spray, then they also stay on this spray. However, it's a really cumbersome and they're really affecting their quality of life. They carry tissue all the time. They go to restaurant eating their friends or families. And these patients, I recommend this procedure. This procedure actually plays very key roles in reducing number of secretions coming out your nostril. So this can be done under any locals or mild sedations. If you don't want to feel anything, you can also a little bit of more stronger sedation. It really doesn't cut or anything. It's not really surgical resections. We actually ablate the nerve inside your nose right behind the inferior and middle turbinates. You go home the same day, and the procedure time itself is only about 20-30 minutes in both sides.
Wow. That's pretty exciting, Dr. Cho. And as I understand it, you've done more than 200 cases at UAB and VA in Birmingham so far. So what have been the outcomes? What are patients saying about their results?
Well, the most recent study came out, about 80% of these patients have meaningful reduction in nasal drainage and they improve quality of lives. So a lot of my patients told me that it was a life-changing experience. They're really happy with the results. Of course, it's not 100%, but there are 70-80% patients, majority of patients respond pretty well. And we're not cutting or anything completely resecting your nerve. So it usually lasts about 2 or 3 years coming out of the study. So you probably have to relieve your symptoms about 2 or 3 years. And importantly, it not completely eliminated your normal nasal functions. So it's more of like bringing the system back into the balance.
That's really cool, Dr. Cho. And even after this type of procedure, are there some lifestyle home strategies that can help to reduce this? What do you recommend that patients do? And for other providers that are seeing these patients, do you have some recommendations of some home strategies?
Yes, of course. So the nasal hygiene is very important. Sometimes saline rinses, trying to mechanically some of the irritants in your nose, especially when you're very stuffy and you did a lot of outdoor work or hike or the social activities. And also avoiding trigger is probably number one. If very dry, you can use humidifier. That also really helps. And also for the providers, I've seen a few patients coming with a drainage. It's the drainage only from one side of nostril, only on the left or the right. You also have to think about the drainage is made not from the rhinitis. Sometimes, in a very typical scenarios, also it can be related from your brain fluid leaks, called a CSF leak. So if you have chronic drainage from one side of the nose, you also have to be very careful about what will be the diagnosis. As a provider, I also just make sure that when they come to our clinic, I usually go over all these risks and benefits at the same time, what will be the cause of the symptoms. So these are the very important before you actually start the management.
Dr. Cho, you've given us so much great information today. And if there is one thing that you wish more people understood about managing a constantly running nose, speak to that now. Give us your best advice. And if there's any newer, exciting research treatments, I would love for you to tell us about that.
Oh, yes, of course. One of the misconceptions is that the runny nose is just always allergies. But in many patients, it could be either non-allergic or mixed rhinitis, which requires like different approach. So if the patient has the non-allergic rhinitis, then those like allergy medication may not have real improvements. So the key is that we have to identify what's the underlying mechanisms, and we probably have to tailor those treatments accordingly. And then when appropriate, I recommend to consider procedure options earlier than later, which may improve your quality of life. Now there are several options available for the ablation technologies. They're all temperature controlled. There's a heat energies, and also there is a cold energies. So there's options available. So you probably can have all these options available so you can actually pick and choose which one you want it to go.
Thank you so much, Dr. Cho, for joining us today and really sharing your incredible expertise. Thank you again. And for more information, you can visit our website at uabmedicine.org/physician. That concludes this episode of UAB Medcast. I'm Melanie Cole. Thanks so much for joining us today.